Good afternoon. Welcome to the Senate Finance Committee. Today is Friday, February 28th. We're going to have a hearing on 5 bills today. One was withdrawn. I will read the bill order. Remember, sponsors, you have as much time as you need, and witnesses, please, 2 minutes. Number 1, of course, is 844 with Senator Hershey, and then 544, 519, 701, and 776. Senator Hershey, you can begin.
Thank you very much, Madam Chair. For the record, Senator Steve Hershey to present Senate Bill 844, which requires a self-service storage operator to provide a notice to the occupant of a self-storage facility that the individual items will be auctioned off. An electronic notice will be sent 10 days prior to the auction, and if no confirmation is received within 5 days, a verified notice by mail will be sent. If you might remember, during the 2024 legislative session, a compromise was made between the Maryland Self-Storage Association and the Consumer Protection Division, and that was erroneously not included in the bill that was signed into law. Senate Bill 844 corrects that and is supported by the Office of the Attorney General. Ask for favorable report on Senate Bill 844.
Thank you, Senator. I see you have a witness with you.
Good afternoon, Senator Bruce Perriano here on behalf of the Self-Storage Association and strong support of this legislation. As Senator Hershey indicated, very last minute, it was a timing situation. One last amendment that was agreed upon, which is a consumer protection language, did not get on the bill. The governor did go ahead and sign the bill that was passed with the promise that we would come back, that is my client and I, and put this amendment on. We have a bill in the House, this bill in the Senate. The bill in the House is moving along, and we're completing our agreement, and that's what this is. And this is all giving additional notice before any lien or sale in the case of any failure to pay rent.
Thank you. Do I have any questions for this witness or for the Senator? Seeing no questions, that ends the hearing on Senate Bill 844. Thank you. Next, we have Senate Bill 544. Senator Bailey, come to the table, please. And you don't have any witnesses.
Thank you very much, Madam Chair and distinguished members of this committee. Senator Jack Bailey representing District 29, which encompasses St. Mary's and Calvert County. Today, I wanted to talk to you about Senate Bill 544. This would authorize food establishments that are businesses that conduct agritourism, Class 4 limited wineries, Class 8 farm breweries, to comply with the requirement to provide a convenient lavatory by providing a portable chemical toilet. So yes, I brought a potty bill to your, to your committee. I currently represent 2 counties. I have businesses that are in each county, and because of the law, the way it is, they are held to different standards on the local health department's interpretation of the law and regulations, which is very interesting for me as I go from one, drive over a bridge, and all of a sudden I have agritourism, and they're held to different standards. This bill would allow for clear and concise guidelines to exist across the state. And you will see that this problem doesn't just exist in St. Mary's and Calvert. You'll see that there are other counties that have people from other counties that have been trying to get this for 10 years. This bill is narrowly targeted to apply only to these agritourism businesses, and I believe that this bill is consistent with other changes in state law that we have made over the past several years to encourage the growth and lasting success of these businesses in our state. Under current law, a food establishment must provide a convenient lavatory that is supplied with approved hand drying devices, kept in sanitary condition, and properly ventilated. Over the past several years, we have seen an increase in the number of agritourism businesses, particularly farm wineries, breweries that offer the public the opportunity to come on their farms to sample and purchase their products. Under these licenses, wineries and breweries are permitted to serve food on site as part of their operation. these agritourism businesses are. They're first and foremost, they were not originally designed to accommodate the opportunities that are now available to them to sell food and drinks on site. Therefore, many of these businesses do not have the facilities required to comply with state law for food establishments. Some of these businesses are in rural zoning areas, or they're on preserved farmland. Therefore, they do not have the opportunity to build permanent restrooms. They can't just go in there and build a permanent restrooms. These laws restrict their ability to grow as a business. But at the same time, we're trying to encourage agritourism and people to come and learn about the rural areas of the state. Constructing these restroom facilities can be a substantial financial burden on these small businesses. I know that in St. Mary's County, we just built an addition for a restroom and a hand washing facility at one of our public schools. It was almost $1 million. I can't imagine being an agritourism business and have to have a bill like that. These small business owners have approached me about the possibility of introducing legislation to give these agritourism businesses more flexibility in complying with the law. Some currently use portable chemical toilets. However, this is only with the permission of the local health department with a number of conditions, such as having to frequently move the portable toilets. I've got one business that has to move their toilets after every Sunday. They're going to be open the next weekend. They still have to pay somebody to come in and relocate them. Right down the street, different operator, not required. We are adding to the cost, which all these things are adding to the cost of them doing their business. This provides alternative and more cost-effective ways for these businesses to comply with the requirements. I am aware that Maryland Department of Health's letter of information on this bill, I want to just respond to a few of the points that they have raised. First, they state that the bill does not have limitations on facility size, operation, or other characteristics to provide guidance on when chemical toilets would or would not be sufficient. I think it's important to note that the statute creating the Class 4 limited winery and Class 8 farm brewery licenses include limitations on the type of food permitted to be served under one of those licenses. We as the General Assembly have given the ability to sell and serve certain types of food on the premises to support these enterprises and entrepreneurs. Giving local governments and health departments the ability to effectively nullify that through regulations that can, in some cases, be very arbitrary and onerous undermines the intent of the state law in this area. Second, they say that the chemical toilets may be appropriate at certain stages of agritourism business, but not necessarily remain so the businesses grow and change. I would also hope that in this case, however, the problem that occurs here is with lands and agricultural preservations. It is by no means a given that they will be able to build such a permanent facility. We just talked about that. Finally, they mention that there are stakeholder groups that have met about this. These groups have had discussions, but they've not taken any concrete action. As you see by some of the letters from some of the people that have had these issues, these stakeholder groups have been meeting for up to 10 years. They have done nothing to help these businesses. I don't see any timetable for an agency or entity to address these issues in their testimony when their businesses need certainty now. This law will provide local health officers and businesses clarity to a vague law. And I want to make one really important point here. I'm happy to report that this bill, in the form that it is in, has already passed the House. And it was unanimous in the House. I respectfully request a favorable report on Senate Bill 544. I thank you all for your consideration.
Thank you, Madam Chair. So, Senator Bailey, just so I fully understand the bill, we in the legislature have been opening up areas within the agricultural communities to expand and explore economic opportunities for businesses, and these businesses are starting to take advantage of those opportunities, yet somehow they do need to have bathroom facilities. So it has been up to the local jurisdictions to determine what kind of porta potties are going to be placed, how they'll be placed, whatever. And if I understand correctly, a total lack of consistency in how that is being done. So the bill before us would establish that here is the policy for everyone on how we're going to do this, because we've opened up these areas to these unique businesses, and now it's simply, okay, we do want to provide the customers with the opportunity to be able to go to the bathroom if they need to while they're there. But clearly, these are not areas where you're going to be bringing in water and sewer. I know in Montgomery County, we've got 1/3 of the county. 1 full third of Montgomery County is in agricultural preservation, and water and sewer is not going to be coming into those areas. But we are seeing a proliferation of all kinds of different ag-style businesses. So the bill before you, and I've got 2 questions. So the bill before us just establishes universal policy, so it's not hit or miss wherever you may be going in the state.
That's exactly right. Thank you very much for that question.
Okay, all right. Second question. I am taking a look through here, and it appears as though the Maryland Department of Health, if I understand correctly, has submitted a letter of information, and yet that letter also includes amendments. And if that's the case, have you seen those amendments, and would you share with the committee your thoughts about that?
Yes, thank you. Thank you very much. I did. I got the opportunity to see these amendments late yesterday evening. I'm not exactly sure whose amendments they are. Right. I'm going to go in detail and talk to you about them. But the one thing I'd like you to understand is that these amendments belong in the toilet. Right?
In the porta potty, huh?
That's exactly. That's it. If I could tell you how I really feel about them, they are not consistent with, and they undermine the entire intent of the bill, particularly as they try to establish timeframes and limitations on agritourism activities that they try to include in the bill. The arbitrary nature of these amendments clearly justify why I am sitting here talking to you about this bill. One of the amendments, activities no longer than 90 days per calendar year. Why is 90 days utilized? Right? They could clearly, I mean, agritourism, they're in the spring, they're in the summer, they're in the fall, they operate in the winter. I have no idea why that's in there. The 10 days, you've got to, it says they've got to be 10 period removed within 10 days after event or the season concludes. So does that mean if we have a rainy weekend, that people don't come and they shut the doors because of the mud? All of a sudden now we've got to have somebody come in and move the portable toilets to a different place? Right, because they had one weekend that they took off because it would be more than 10 days. I don't understand many of their amendments. And one thing I will just tell you is that in each of your jurisdictions, your jurisdiction defines agritourism in its own way because each county is different. Prescriptive definition and the way they try to do that is simply a backdoor attempt to set a state definition beyond what is already in law and what we use in our counties. The definition in the land use article, where it appears some of these examples are taken from, are only meant to be examples of what agritourism includes. The amendment requires running water for hand washing stations. But there are portable hand washing stations that have water and not running water, and they operate by a pump. I think we've all seen those. The last portion regarding being used as a substitute for permanent restroom facilities reads to me like it nullifies the whole bill. As the entire issue is these businesses often can't build these facilities due to agriculture preservation laws. And I appreciate your questions. I'm just going to say that in the future, right, if a department wants to talk to me about a bill, they should come to talk to me with an amendment. They should not put in a letter of information and hide in there an amendment that they'd like to put on a bill. I just think that's underhanded and should not be the way that we operate.
That's how you really feel, Senator.
Thank you, Madam Chair. I just
Thank
took
you.
her flush.
I see that Senator Motz took his light off, and Senator Guile took her light off, so we have a question from Senator Lamb.
Yeah, thank you, Madam Chair. Just reading through this testimony, I guess I'm now newly familiar to the Governor's Intergovernmental Commission for Agriculture, I guess GICA, in this work group. And, have you brought it up before them or the Department of Agriculture or anyone else to try to work through? I guess MDE is involved, MDH is involved here too, but.
And the Department of Agriculture is actually back here in the room. And we have worked with them about this. And I think that's why the bill moved through the House so quickly.
Okay. And did you give any consideration to having just the department draw this up in regs, like compelling the department through legislation to draw regs?
Senator, we've been working on this for several years with the local health officers. And this has been quite a difficult procedure.
I guess one of my colleagues is mentioning the local health officers. Is the challenge at the departmental level or at the local health? I mean, granted, most of the local health department folks are actually MDH employees, but where is the hang up here?
So the hang up is for the farmers, the people and the business owners that want to get one answer, right? And if you'll see that there's people in here from Calvert County, Washington County, different places, and the local health officer gives different ideas and different requirements. I've got one in Calvert County, two different businesses right down there almost on the same road, and they've got two different requirements for the same type of businesses.
But the department, MDH, could issue regs just to kind of standard level set across the board, right? And you're saying that they've chosen not to.
They've chosen not to do that.
Do you have any sense why?
I think I should hold my tongue on the Department of Health.
Okay, we can talk
opinion.
offline.
Yeah.
Senator, the bill that passed the House, you said it's already passed the full House.
Yes.
It's here, there's no amendments on it.
No amendments.
Thank you.
Thank you.
Question, Senator Ellis.
Yes, thank you, Senator Bailey. So we have neighboring counties, and I know a few years ago, there was a church who had annual food fair, and a lot of people got sick, and the county came in and really, health department really kind of put in standards to prevent that from happening again. So I'm looking at this right here. I think people were saying the Department of Health have this information with amendments, but it seemed like it's the Department of Environment that sent this letter of information in. Maryland Department of Environment with the recommended amendments. That's what I'm looking at right here. And so
I really appreciate you bringing this up because if you can tell which one of them sent these amendments in, you definitely help me because the Department of Environment talked to me and said, we didn't send any amendments in, right? And they sent them in under the Department of Health's information letter.
That's what I'm looking at. I'll share with you later.
Okay.
But the letter, looking at the Maryland Department of the Environment, Senate Bill 544, Food Establishment Portable Chemical Toilet. So this is definitely your bill. And so I just want to send you in the right direction. So different uses and time frames. And one thing I'm really interested in what you think about this. Placement of these chemical toilets 200 feet from any water source, well, or food preparation area. So their recommendation like that, why would you have problems with that particular recommendation amendment to go in the bill? I mean, my question is, are all of them bad or just some of them?
So I don't actually understand what that means when it says 200 feet, right? Does it mean, and it says every water source?
No, 200 be placed at least 200 feet from any water source.
Right.
Well or food preparation. So I'm concerned about the water source and wells. So if this one farm and this one agritourism area business is next to another farm or home with a well, and they choose to put the chemical toilet on the property line 10 feet away from their neighbor's well, I mean, what's the problem with like a recommendation like that? I'm not saying I agree with all of them, but one like that.
So okay. I'm going to tell you that I don't understand at all what this says. It says be placed at least 200 feet from any water source.
Correct.
Okay. So does that mean it needs to be placed within 200 feet of where they're serving the food? Or does this mean that every place on that property that's open for agritourism, there needs to be a potty when they're 200 feet from every pond? Right? When every time there's a wellhead, there's got to be another portable potty. I have no idea what this means. So I can't definitely comment on the fact that I would want to put something in here that's so arbitrary as this.
Well, this is not arbitrary. This is specific. This is like, we want to protect the water source. And I've dealt with bills like this before, and a lot of me with the health department and Department of Environment, and they talk about they protecting our waters, especially in Southern Maryland, a lot of wells, and I kind of back off on a lot of these issues, right? Because no one wants bad water or polluted water or anything like that. And so in here it's talking about well, which is the water source for most of our constituents in Southern Maryland. And so so that's the placement of these potties, chemical toilets, sorry. Potties. Baby talk. I apologize. Yeah, sorry, my babies are grown. So I'll talk to you about that later.
Okay.
All
right.
I'm trying to
Appreciate
understand that. Yeah, thank you.
Before I call on Senator Motz, aren't these self-contained that have to be emptied? These aren't.
Yes.
These aren't leaking into the ground.
No,
or
they don't
in any
leak.
way would contaminate a well or other water source because they're totally self-contained and they're emptied periodically.
Yes.
Thank you, Senator. Senator Motz?
Thank you, Madam Chair. I wasn't going to ask a question, but yeah, I heard some of the questions and stuff, and I want to kind of follow up. I thank you for bringing this legislation. I actually have an answer. I can't avoid this. It's all over my district. I'm very familiar with the challenges, and I understand why it's been such a challenge, and that it's sort of we have a one-size-fits-all, and what I like about the bill is it's just straightforward. It's simple. Here are the 5 things you need to do, right? And I think reading the bill without having firsthand experience in dealing with these issues, you may say, well, okay, there's these 4 things, but that's the Wild West, and all you got to do these basic 4 things. But in reality, these are 4 requirements. These are businesses that have to operate. So they meet these 4 things. Say you get a bad operator, right? And they say, oh, well, we did all 4 things. And I think that someone could read the bill and voting on it and be misled to think, well, there's nothing that can be done to address the problems with that business. In your experience, if these 4 things are in place and the business is not run well, is there anything that would restrict the Department of Health or Department of Environment from coming in and either making them adjust their operation? Because, in your experience, what all else do these businesses have to follow? What other regulations, cover the business operations in addition to what these provisions would enable them to do? And then, and what type of enforcement is available to the health officer or the Department of Environment?
Thank you very much, Senator. And as you well know, coming from a rural area, it's not just these things. They have the county health officer inspects these businesses. If they're going to have school children coming there, if they're going to have field trips, if they're going to have any simple infraction, right, causes an immediate inspection, and then they can shut them right down, right? And so I think that compliance with this is with the way it's worded will be very straightforward.
Senator Ellis would like another bite at the apple.
Just a tiny little bite, Madam Chair. So the issue is, you mentioned the containment of these units. So they've been known to spill and kind of break when they're being picked up to put on a truck. And so the issue is and we've dealt with this in Charles County with a lot of neighbors, a lot of wells, and with the issue of accidents happening. So yes, they are fully self-contained, but sometimes they're going to go to pick it up and the pulley breaks and the plastic container just kind of splits. And so that's the issue with close to sources of drinking water for their neighbors. I just want to mention that.
Thank you.
Senator, do you envision these as be like the individual porta potties, or are these those little actual portable bathrooms that you see like on golf courses and nice places?
So these people are inviting people to their farm for agritourism, right? From the experiences that I've seen, a lot of these are on trailers, right? They are very nice situations. It says that they have to have water available, right? So they are not just the porta-johns that we see come in on the trucks. These are nice. They're all the experiences in the farms that we have that are utilizing are much nicer than that.
Thank you. Do you have any other questions for Senator that we thought was, Senator Lamb, we thought this was going to be a really short hearing.
I thought so too.
So these are you mentioning these are, because sometimes you see these things on trailers and whatnot. Is that what you just said? Like they're
Yeah.
full on, so these are like Cadillac porta potties. Right, okay. They get like pulled in. It's not just a little standalone.
They're much, even the ones that are standalone are bigger, and they are much more substantial.
All right, maybe a site visit.
Okay.
All right. Oh, my. Okay, that ends the hearing on
Thank you.
Senate Bill 544. Thank you, Senator.
First and last potty bill. Thank you.
Next, we have Senate Bill 519. Senator Charles is here enjoying this conversation.
Yes.
Hopefully, Senator Charles, we've used up all our questions, and you're going to have an easy time.
My goodness. I don't know if you want to be in there with everybody now. My God. I know you all wish you could be down there with me. Good afternoon, Chair Bidle, Vice Chair Hayes, and honorable members of the Finance Committee. Thank you for this opportunity to present Senate Bill 519, the Prostate Cancer Care Access Grant Program and Fund Establishment. This bill establishes and ensures a specific fund is allocated for prostate cancer awareness and services. Every 100,000 men will die from prostate cancer in Maryland, with over 60% being black men. The high cost of Maryland health care for treating prostate cancer is insurmountable, and it's a huge obstacle to many people seeking proper treatment for this disease. The cost of care for the sickness can range from $5,400 to $40,000 a year. Our goal in the state of Maryland should be to keep the affected men in stable financial conditions while giving them the best chance of preserving their health. The passage of this bill will see a direct positive impact in the lives of prostate cancer patients and their families. Senate Bill 519 is not just about statistics or policy, it is about people. It is about fathers, it's about brothers, husbands, and sons who deserve a fighting chance to lead healthy lives, free from the crushing weight of medical expenses or the barriers of inaccessible care. By passing 519, we are declaring that the lives of these men matter, that their health and dignity are worth our commitment. I know there is a $100,000 price tag on this bill, but with our state budget covering nearly $63.1 billion, this grant's funding would only account for a very, very small percentage of this budget. With all that in mind, I urge a favorable report. Thank you.
Thank you, Senator. Do I have any questions for Senator Charles? See, we used up all the questions. Thank you, Senator. That ends the hearing. On porta potties. Senator, that ends the hearing on Senate Bill 519. Now we have Senate Bill 701. Senator Reedy.
Thank you, Madam Chair. I think I have a panel. I have a couple of people signed up favorable.
Yes, sir. Kimberly Tracy.
Thank you. And I think there's a virtual witness that could go later, I think, if need be. That's fine. That's fine. If she wants to, that's fine. Yeah. So just sit right over here. Yes, thank you. Sit right there. Thank you. Yeah. Madam Chair, thank you so much. And I know we've all had a long week, and I just think it's very important that to understand Maryland is in a situation right now where we know that we want to improve our private sector economy and job growth. And the bill I'm presenting to you today is not a bill that's going to bring another multinational corporation to headquarters in Maryland. But what it does do is give additional tools to entrepreneurs and folks who work in cottage foods to have the chance to expand their business and do more in the cottage food space. And it was brought to me by a friend and a constituent, actually not a constituent in my district, but someone who reached out about this issue, and I thought it was worth the discussion and a bill. Folks will hope to expand their business, their cottage food, cottage baking business, by adding items that require refrigeration and what is labeled as potentially hazardous currently in the law because of the need for refrigeration. And it's a long list of items, but items like custards, meringues, fruit tarts, pies, cheesecakes. Currently, to produce pumpkin pies, certain kinds of fruit, certain kinds of pies, obviously not all kinds of pies, have to be refrigerated and inspected by the health department. Obviously, for someone who's doing a cottage food type of setup, working out of a commercial kitchen or commissary kitchen is going to be very expensive. It's going to be like having to set up really a much larger small business in order to do it. Now, there's good reasons for wanting to protect on the issue of refrigeration, obviously, because things that spoil could really hurt someone. So clearly, it's understandable why there's been a bit of a dividing line. Just speaking further about the challenges of a commercial kitchen, you're going to have limited access to the facility. It's hard to have off-hour time, et cetera, et cetera. So baking at home, creating at home eliminates a lot of these costs. So this bill is trying to setting up for there to be a refrigerated baked good section within the cottage food product section of the law. Ohio has a home bakery law that requires a license. The law allows your home to be recognized as a bakery and allows you to prepare perishable goods for sale. A home bakery in Ohio is permitted to manufacture non-potentially hazardous bakery materials and potentially hazardous bakery products, such as what I mentioned earlier, like cheesecakes and custards, which require refrigeration. So I'm putting this bill forward so we can discuss this issue. I understand we have some opposition from our friends at the health department. And I've been speaking with them. I think the nature of the opposition is well, at first the nature of the opposition was we don't really like the idea because we've never done it and because it is potentially dangerous. But I think in talking to them about the idea of like what Ohio does, it's more of a, well, we'd have to set up a whole nother sort of regulatory process or licensing process. I feel like there's a way to do this. That could get this done. But I wanted to put it before the committee, and I'd like to have the folks who've come to testify and then be happy to answer questions. Thank you, Madam Chair.
Thank you, Senator. Morris, would you like to go next?
Yeah, we'll go first with you.
Madam Chair, Mr. Vice Chair, members of the committee, thank you for the privilege of your time today. My name is Juarez Lee Shelton. I am, among other things, a Maryland cottage food baker. And I come to you today as the originator of this proposal, drawn into Senator Reddy's bill that's before us today. The bill represents a tremendous expansion of the cottage food industry in Maryland. Under its terms, as stated, cottage food bakers will have the high privilege of being able to bake and sell refrigerated baked goods to the public. These include cheesecakes, custards, meringues, fruit tarts, pies, and other types of desserts. At present, none of these items are permissible to be sold in Maryland under the state's cottage food guidelines. All of the above listed items are desserts that the public as a whole generally enjoys, along with things that are allowable under the state's cottage food guidelines. Cottage food bakeries, which represent both a significant supplementary and even primary source of income for many, would greatly benefit from being allowed to bake and sell these products. The current prohibition places an undue burden on cottage food bakers by requiring them to have access to commercial kitchens to produce these products. That requirement has multiple facets, financial and otherwise, that cripple the ability of cottage food bakers to produce these goods. The commercial kitchen requirement is based on the absurd and unfounded notion that cottage food bakers are unable to observe basic food safety guidelines when preparing, baking, and storing these foods in their homes. No data supports that assumption whatsoever. Cottage food bakers, unlike commercial bakers, take extraordinary care in their products, perhaps more so than the commercial bakers, knowing that the success of their business depends on a consistent customer base, which will not occur if you have constant lapses in food safety. This bill abolishes those restrictions on cottage food bakers and allows them to bake and store those items in the home. Thank you.
Did you bring us any samples?
I really, really wish I could have done that in the name of ethics, but no,
Just
ma'am.
kidding, thank you. So next we have Kimberly, right?
Yes, Madam Chair. In March of 2018, I listened in this building as home bakers testified to try to expand our cottage food laws. Today, I'm compelled to speak up. 7 years later, home bakers are suffering under misguided policy decisions by Department of Health bureaucrats that seem to undermine the legislative intent of Maryland lawmakers. I have great admiration for bureaucrats. I served in the United States Army. I have a master's of government from Johns Hopkins. I spent a decade in the federal government and met my fair share of bureaucrats, but the ones at the Department of Health really take the cake. Since 2018, home bakers have been on a roller coaster of new policies and frequent changes issued by the Department of Health that continually hinder our ability to run a successful business. We jump through hoop after hoop and never feel like we are on solid ground. Just last week, I found out that bureaucrats in the Department of Health quietly destroyed my cottage food business, which consists almost exclusively of teaching cookie decorating classes. This works best for me as I navigate the sandwich generation of caring for school-age children and an elderly parent. I have invested thousands of dollars turning my passion into an LLC. According to the DOH, packaging of wet icing is not allowed. This policy makes no sense. They already require us to have our icing tested by an accredited food safety lab. Furthermore, every cookie decorator safely uses packaged wet icing in their homes while decorating cookies. As a solution, the Department of Health states we can have participants make icing in class. I'm very curious how they came to the conclusion that having multiple people, including children, each operating electric mixers plugged into walls in classrooms with a limited hand washing stations protects the public's health and safety more than bagged icing. It is absurd and a perfect example of how the DOH seems more interested in thwarting the success of cottage food businesses than engaging in thoughtful and informed policymaking. Every person in this room has been fed by home cooks their entire lives. The DOH has lost sight of this. I cannot testify as to why they are so intent on squashing cottage food businesses. I can only testify that they have succeeded in destroying mine. Home bakers are a good thing. We do good work. Please help Maryland cottage food makers succeed without fears of our businesses being destroyed by the misguided whims of the executive branch. Thank you.
Questions for this panel?
We have a virtual too.
Okay. All right. Who is the virtual? Let's see. Ellen Hamlet. Are you ready?
Hi there. Everyone can hear me okay? Mm-hmm. Thank you for the opportunity. Thank you, Chair Vidal and members of the committee, for the opportunity to testify in support of this bill. My name is Ellen Hamlet, and I am here on behalf of the Institute for Justice to urge you to support this bill, which will increase access to local food and expand opportunities for cottage food entrepreneurs in Maryland. IJ is a nonprofit advocacy organization that supports creating opportunities for home-based cottage food producers to have an accessible path to entrepreneurship. Studies show that reforming cottage food laws has the greatest impact on women of modest means, many of whom have children living at home. Selling homemade food is an incredible way for people, especially people in rural areas and food deserts, to start small businesses without the massive upfront costs. Consumers love buying local, and these businesses keep money in the community, creating jobs and strengthening local economies. Maryland has already embraced cottage food businesses, but this will take it to the next level by allowing certain refrigerated baked goods to be sold through this business model. Research and real-world experience shows that even perishable homemade foods can be safely produced and sold from the home. Many states already allow the sale of these foods with basic safety requirements like refrigeration and clear labeling. Research shows that even the states that allow a broader list of perishable foods to be sold from the home, including meals that include meat, there have been no reported cases of foodborne illness linked to their homemade food laws. In light of this evidence to suggest that homemade foods do not pose a consumer threat, but do substantially boost economic opportunities and community bonds, IJ recommends passing a favorable report on this bill. This bill pragmatically expands opportunities for cottage food producers and consumers without compromising food safety, because we know that these foods do not pose a threat to public safety. So thank you for this time, and I'm happy to answer any questions or address any concerns.
Do we have any questions for this witness? Senator Lamb.
Yeah, I just have one question. I guess maybe this is probably to the sponsor, and you can kind of address this however you wish. Just looking through the opposition testimony here, and obviously much of this discussion is centered around the public health concerns, the health concerns. Obviously, recognize no one on this panel is technically kind of has the public health or healthcare background on this, but when it comes to these regulations, everything is kind of a bit of a balance, right? I mean, regulations are in place to protect people. I think the folks on this panel will probably say it's imbalanced, overprotective, I guess, and could be lifted. But, what's the response here to some of the public health folks that will probably be coming up next about the concerns with, lifting a lot of these restrictions and making it easier for folks? Because, what will probably be contended from, and what we can see in this opposition is that the balance is correct right now. And, this would be tipping the scale to put people's health at risk.
Oh, I just don't know that there's evidence of that in the states that have allowed for more of this. And it's one reason why I'm very open to an amendment that would make it a little more clear that there could be an additional inspection or an additional sort of requirement that someone have the right kind of things in their home to be able to keep things refrigerated. But we also have to have a sense that people, when we talk about the balance, you are right, a lot of times this is striking a balance, but most of the time what we see with our health department, quite frankly, is an over-reliance on narrowly interpreting law to the point where it becomes, it's not about protection, it's about protecting the person who's making the ruling from getting in trouble. And I see that over and over. In the last bill, or 2 bills ago, we talked about that with the porta potties. And we can joke about porta potties and baked goods, but here's the thing. A lot of this is because there's like this paralysis to interpret laws so tightly, regulations that are supposed to have some flexibility so tightly that we don't allow for things to just flourish and grow. To answer your question, I mean, I understand there would need to be perhaps an additional regulation or restriction so that it's clear that you have to identify what's in the product and you have to have it refrigerated. But I feel like we need to probably, considering where we are right now economically in our state, I think we need to be erring more on the side of a little bit more freedom and responsibility and a certain amount of, if someone was going to buy that, then as long as it's labeled properly and that we've made sure that it's a reputable person doing it, I think we should move that balance a little bit further the other way. I know that's not it's a call. I mean, it's a policy call, but I'd like to see us loosen that up and be a little bit more willing to open it up for people to do more.
I think just on the point of that there have been no cases or a few cases or whatnot, I think one of the challenges here, particularly when it comes to cases like this, is that people may get a full foodborne illness and they may not report it. And so, you feel bad for a day, you get over it. Some people may get a little bit more sick, but then they get over it, or a couple people do, and nobody is reporting it. And so then it's hard for us for the health department and others to do an outbreak investigation to figure out where the origins of this are, to maybe have, corrective notification to whoever was handling the food, next time do this, this, and this. But like the fact that there's no reporting doesn't mean that, people aren't necessarily getting sick.
Correct, but if only one or two people got sick and got over it, are we really needing to keep everybody from doing this kind of thing because somebody might get sick somewhere? I mean, I think you have to look at it that way too. Yeah, obviously, I get that sometimes somebody may get sick from something and not realize how they got sick, but that could happen. That could happen in the current restaurant business too. I mean, so even with all the inspections that they undergo. So, I mean, that's more of a maybe a philosophical debate. But I understand your point. I mean, I'd really like to work on this issue, though. I think that our witnesses have made and many people like to make a compelling case that there's a need to be more flexible so that we can let, our small business economy grow. And I think what we're hearing is that this really helps people who are both in areas of the state that need more of this kind of thing, but also people who are more disadvantaged or need more flexibility in their lives, whether it's moms or whether it's folks who are working in whether it's a rural area or West Baltimore, right? So anyway, but I don't know you, and I probably won't agree on it, but that's okay.
All right, thank you.
Thank you, Senator. I don't see any other questions for this panel. Thank you very much for your testimony. We do have one unfavorable, Clifford Mitchell.
Chair Beidel, Vice Chair Hayes, members of the committee, happy Friday. I am Dr. Clifford Mitchell, the Director of the Environmental Health Bureau, the Maryland Department of Health, and I'm delighted to be with you here today to talk about Senate Bill 701. Let me start by acknowledging the history of cottage foods. You all have my written testimony, so I won't dwell on that, but I do want to talk a little bit about why the regulations are the way they are, and a little bit about some of the regimes in the regimens for regulation in other states, because I think the sponsor, I'm acknowledging, we've had some conversations. I really want to thank the sponsor for raising this issue. And to acknowledge there are some state-to-state differences. And I'll talk about those in a little bit. But let me first talk about cottage foods themselves. We have been working very diligently under the direction of the legislature to implement the cottage food laws on the books and to create a predictable market for the very many hundreds of cottage food producers across the state, which now actually numbers more than that. The legislature set up a system in which cottage foods were defined as non-potentially hazardous for a specific reason, which is that we do not inspect, we do not license. We wanted to make the barrier to entry as low as possible for cottage food producers. So we really have tried our best to provide an environment in which cottage food can be produced and sold across the state at a variety of venues. Under the direction of the legislature, we also implemented a rule to allow cottage foods to be sold in retail stores. So I'm happy to answer questions about this bill. I just want to emphasize that at the end of the day, our goal is to provide predictability for consumers and a safe environment and a safe product.
Thank you, Dr. Mitchell. Senator Reedy, you have a question.
If I could just ask, and I do appreciate the dialogue about the issue and back and forth with the office. What would be the problem with establishing a a license that would require, say, an annual or biannual inspection? I know the challenge would be, well, we don't have the resources or the time. I feel like we could roll that into the rotation of what you all are already doing with your inspections. I mean, can you just comment on that? Because I understand the desire to, even though I tend to be like, just put a label on and tell people, hey, this might be dangerous if you buy it. That's kind of my solution, but I'm not the one who's in the public health, so I recognize that. So I understand we want to be sure we protect people. I mean, but what are the challenges with that?
Thank you, Senator. And again, thank you for sponsoring the legislation. A couple of things. In Ohio, Pennsylvania, and other places, there is an annual inspection and an annual licensing fee. So the cottage food kitchen has to meet certain stringent requirements. It's not necessary. It's not a commercial kitchen. But, for example, they can't have pets in the home because we are concerned about the transmission of allergens to and cleanliness associated with pets. We are particularly concerned, those states are particularly concerned about some of the potentially lethal pathogens like listeria and others that, it's not necessarily just a question of somebody getting sick for a day. There have been cases where people have actually died as a result of exposure to baked goods. So, we in those states, part of the challenge, is financing that. So they have a licensing fee. This would fall either on the state health department or the local health departments to go into people's homes and do that inspection. There's no theoretical reason why that couldn't happen. It would be, given the numbers, it would be a substantial burden from a staffing point of view for people who are specialized and need to do that. But if you're asking if the legislature created a system like that, we would obviously work to implement it. It is a radical change from what we've done now because we have tried to make that barrier to entry for other goods completely
But couldn't we keep it so that barrier to entry is lower for the just baked goods and then have a step up where you?
There's no theoretical reason why we could not do that.
I mean, I'm a guy that complains about us raising fees, but if it's reasonable to have a fee, even a substantial fee annually, if you want to do this. I mean, it shouldn't be $1,000, but maybe it could be $100 or whatever we determine the amount would be, for barrier to entry. So if the fee was high enough, that would be able to fund the proper staffing, conceivably.
Yeah, I do want to acknowledge, to the panel that advocated for this, we really want to encourage cottage foods, and I totally acknowledge, having eaten baked goods myself on occasion, that it is we must acknowledge that most of the time people who eat these are in fact going to be perfectly fine. We're always concerned about sort of that, making sure that we're not inadvertently allowing product to come onto the market that has a high likelihood of causing damage to people. So we really, again, we are looking for those 5% cases that are going to cause the most severe problem, and that is part of the reason the regulations are structured the way they are.
Okay, thank you. Thank you, Madam Chair.
Thank you, Senator Mouse.
Thank you, Madam Chair. I'll be very quick because it's Friday. Dr. Mitchell, thank you for all your work on this. I mean, this is big issues for rural districts, very big issues. But I just want to make sure, so the issue is refrigeration in the home, right? That's the issue.
It's refrigeration all along the path to the consumer. So, for example, the question partly is, how is the product, how consistent is that refrigeration temperature held from the time that the product is produced? Because heating and cooling are the most risky parts of the food safety process. It's when you heat things and cool them and you don't do it as you're supposed to that you run into problems with bacterial growth. So part of the problem that we have, and the St. Mary's County, for example, with ham that Senator Ellis mentioned previously, is a good example. You have to hold things to temperature all the way along the process. So it's refrigeration in the home, and then if there's transport to the consumer, that temperature is held that entire time.
Yeah, I appreciate you clarifying that for me. And it's really hard to create a one-size-fits-all complete system of regulation where you know everything's perfect. I'll give you a great example. I'm an individual who is inspected, and I have a refrigerator that has to be at a certain temperature. And the temperature was being taken on the refrigerator, and the doors kept open. And of course, the temperature goes down, even just through the inspection process. And so the idea that, we create a perfect environment all the time it's a real challenge. But I just wanted to make sure that was the issue here, it's just refrigeration.
Well, no, so Senator, pardon, so refrigeration is the most important part. We are also concerned, obviously, about potential sources of contamination. Right. So we want to make sure that you need two things for that bacterial growth. One is you need bacteria, and the more problems you have with contamination or cleanliness outside when you're doing the food preparation, the more opportunity for bacteria to enter the environment, and then you need proper heating and cooling. So it's really a combination of those things.
Okay. Thank you.
Thank you, Senator.
Any other questions for Dr. Mitchell? I don't see anything. Thank you very much for being here today.
Thank the committee. Happy Friday.
Have a good weekend. I'm going to apologize to the committee before I come up because I have a pretty big panel, but I don't think they're all here, so it's the last.
All right, now we're here, Senate Bill 776, sponsored by Chair Bidel. And as I call your name, please feel free to come up to the table. I see Michael Patty back there, Jamie Sexton, Andrew Nichols, Jake Whitaker, and Paul Ellington. 1 minute. Madam Chair, you have all the time you need. The witnesses have 30 seconds. Thank you.
I'm sorry, I didn't hear the end of all the time I need, but what?
You said the witnesses have 30 seconds.
I'm going to actually shorten my testimony a little bit because I have a lot of detail here that I don't really think you need to hear. Thank you, Mr. Vice Chair, members of the committee. This is Senate Bill 776. It establishes a work group to study the rise in adverse decisions in the state healthcare system. So we'll bring together members of the Maryland General Assembly, state agencies, healthcare providers, and health payers to look at why we're having so many denials. And actually, there's been some amendments in the House to add different people to the work group. We're going to be discussing this for some other members, and you'll hear about that from folks that are favorable with amendments today. So an adverse decision occurs when a health payer, whether a private insurer, Medicare, Medicaid, or managed care organization, MCO, denies a patient's claim for necessary health services or prescription drugs. And in recent years, the frequency of the erroneous adverse decisions has surged, raising serious concerns in Maryland. Insurers issue adverse decisions more than 50% of the time for certain health services, such as pharmaceutical claims. The fiscal year 2024 Office of the Attorney General, Education and Advocacy Unit appeals grievances report reveals that while only 10% of the adverse decisions in the last decade have been challenged, 54% of those were ultimately overturned. The consequences of this rising trend are severe. Additionally, adverse decisions increased out-of-pocket cost and medical debt. Healthcare providers also experience significant challenges as they must divert clinical and administrative resources to contest inappropriate denials, creating additional financial strain and operational uncertainty. Standardizing the data collection on adverse decisions is essential for addressing these issues. By establishing uniform reporting requirements, Senate Bill 776 will provide data necessary to track the trends. We have some requests from additional members to serve on this. Someone from MedChi, from a FQHC, 2 physicians. And so I think that we're going to really have to look closely at who needs to be on this work group. But the time that I served on the ED wait time work group, it was very helpful to have all the stakeholders at the table. And we really learned a lot and shared a lot, and I think we want to make this to be a really complete work group. So I ask that you give favorable consideration to Senate Bill 776. It's a crucial step toward a more transparent, fair, and patient-centered healthcare system. And for these reasons, I respectfully request a favorable report on 776. Thank you.
You guys may proceed as you're ready.
Thank you, Mr. Vice Chair and members of the committee. My name is Jake Whitaker on behalf of Maryland's hospitals and health systems, here in strong support of Senate Bill 776. As Chair Bidle mentioned, denials are on the rise, and it's a substantial issue for providers. And just from a hospital perspective, we've seen substantial growth since 2013, and we've seen even faster growth in recent years. And this has a significant impact on hospitals, providers, and patients around Maryland. As denials grow, more patients face unnecessary delays in treatment, and this raises out-of-pocket costs for patients when their claims are denied. Or worse, many times patients are forced to postpone or forego necessary care when, for example, the request for a prior authorization is denied. And these rise in denials really cause hospitals to divert resources from patient care to kind of navigate that insurance bureaucratic process to work through those denials rather than serving patients. And just to kind of share some data with the committee that we've surveyed from our hospital members, denials have grown substantially since 2013, and we've seen a significant increase in the last 6 years. In the last 3 years alone, we've seen $1.4 billion in denials, and we've seen a drastic increase in payer denials in the last 6 years. So for example, medical necessity denials are up 79% in the last 6 years alone. And we've also seen an increase in ED denials where we've seen them more than double in the last 6 years. And as Chair Bidle mentioned, there's some challenges with the current reporting processes and appeals processes. So we think that this bill will bring a lot more transparency and accountability to the reporting process in the state. We've seen through some of the work that we've done to address payer denials that there's kind of inconsistency in state reporting. So for example, one data set said there was 191 ED denials, and another data set said there was 25,000. So I think it's an issue where we're just not counting the same things and we're kind of comparing apples and oranges. So we think that with greater policy clarity, policymakers will have the tools they need to really make substantial changes in this process. So for the aforementioned reasons, we request a favorable report. Thanks.
Thank you, Mr. Vice Chair. Really appreciate the time. For the record, Jamie Sexton here on behalf of the Maryland Insurance Administration. Chair Bidle explained this bill very eloquently. Mr. Whitaker added some really wonderful data points for your consideration. I just want to add a few points from the vantage point of the MIA, the regulatory agency here in Maryland. We regulate a little over a third of the commercial insurance market here in the state. We're very fortunate here in Maryland that we have really robust appeals and grievance law, which places a lot of requirements on adverse decision reporting and appeals processes. The work group created by this bill represents a really unique opportunity to look beyond just the market that we regulate and look at what's happening statewide across different markets to see how we can help standardize and streamline the process, much to what Mr. Whitaker commented on. As a regulatory agency, we recognize that prior authorization and utilization management are important tools in carriers' toolboxes. But what we're seeing is pretty concerning with regard to a rise in adverse decisions in our state. I know that we're seeing it in our data. I'm sure that you're hearing about it from your constituents and from those that are testifying before your committee on a variety of bills this session. I know that adverse decisions have been a really hot topic, and I'm sure that you're hearing a lot about this rise that we've been seeing year over year. We think that this work group can help us understand the trends that are in existence so much better and can help start informing the ways that we as a state can start thinking about how we can address those trends. I appreciate your time. Thank you. We request a favorable report.
Mr. Vice Chair, members of the committee, for the record, Dana Kaufman. I'm here on behalf of MedChi and several other healthcare organizations. You have my written testimony, so I'm going to pretty much just say me too on the reasons for this. It's pretty obvious, and we would like to have a adjustment to the work group by putting a MedChi representative as well as instead of one physician, two physicians, and then somebody from the FQHCs. As you remember from last year's bill, the prior authorization and utilization management bill, MedChi has devoted a lot of time and resources to working with our patients and our physician members to try to rectify a lot of what we're seeing now in the commercial market, and we'd like to continue that on this work group. Thank you very much.
Thank you, Mr. Chairman. Michael Patty here today on behalf of Maryland Community Health System, a network of federally qualified health centers across the state providing behavioral, primary care, and dental coverage. I'm not going to repeat any points we'd like to be added to the work group as well. The House adopted that amendment, and we hope the Senate considers it as well, and we hope for a favorable report. Thank you.
Thank you. All right, I guess that's everyone on the panel. Are there any questions for this panel? All right, seeing none, thank you so very much. And I'm assuming, Jake, you testified in the absence of Andrew, maybe?
That's right, yeah, I was representing MHA.
Okay, and is Paul Ellington still in the audience? No? What about Robin Elliott?
I'm here for Robin as well.
Excellent. All right, that ends the testimony, and that ends our hearings for the day. Thank you.